delighted that I was elected to be the president of FEAM, the Federation of European Academies of Medicine. Part of our activity in FEAM is to be a partner with 4 other European academies in a group called SAPEA. And SAPEA stands for Scientific Advice for Policy. And this was an idea by the last Commissioner for Health, Mr. Moedas, Carlos Moedas from Portugal. And he said he wanted to have independent expert advice for the EU to make policy decisions. And this could be in any areas of science, biomedicine, or clinical medicine. In addition to the group of SAPEA from the academies, he made a group called the Group of Chief Scientific Advisors, GCSA, and they were 7 very senior scientists from 7 different countries in Europe of 7 different disciplines. There were a Nobel Prize winner, a nuclear physicist, social scientist, for example. And between SAPEA and GCSA, areas of importance to the EU were defined. And what happened was there was a lead academy from these 5 chosen to be the mastermind of a report in an area that was thought about. So, for example, microplastics was a report that was produced in spring of 2019 and really hit the headlines, and is going to be the father of a new report on macroplastics in the environment. Now, the one which FEAM took on as the lead academy was transforming aging. And it did that because it was very clear that the aging population was rising really quite dramatically in Europe. And this had immense personal, family problems. It had immense care problems for people with great disability, and had great problems in terms of the advancing dementia care which was needed. So we set about just over a year ago with a group of experts from different countries in Europe. There was a chair from Geneva who was an expert gerontologist, Jean-Pierre Michel, and then there were 2 co-chairs, one from London, who was an expert in defining cohorts of people who were aging and what their endpoints were, and one from Ireland, who was doing very similar things in Dublin. And on the group of experts, there were particular experts in cognitive function, in cardiovascular function, and so on. And my own field is infection. But I was there as what was called the coordinating physician. And my role was to make sure that the whole thing was joined up, there was nothing missing, and to help in the presentations when the report was finished. Now, the report is finished and has been accepted by the EU and has gone to a group called SAM, the Scientific Advisory Mechanism, and they will look at this in detail to engage with policy. Now, the major findings were actually very simple in many ways, but very, very important for the future of European healthcare. The basic idea that emerged, that was very clear, was that education about aging must be started early, and by early we mean primary school and throughout education, to accept aging as a normal phenomenon, and there should be no prejudice towards aged people. The other thing was to in terms of starting young, was to develop methods of healthcare that would prevent premature aging and would preserve good function well into later life. And we're talking now of early life and midlife. The factors that came out weren't surprising, of course. The first one was obesity, a great cause of diabetes mellitus type 2, and that was shown to be a major cause of cardiovascular and renal disease, causing profound disability any age from in midlife, let alone in older life. Physical activity was shown to be very, very important as well, maintaining muscle, maintaining cardiovascular strength. Education and educational achievement was also found to be very important in the later development of dementia. Now, of course, there are genetic reasons as well for aging in a bad way, producing disability. And it's disability-free older age which we are aiming for in this report. So the report has gone to the EU. We're looking forward very much to hearing the policy decisions that are coming out. One thing which has come out, which is very, very important and is a secondary phenomenon, but it is crucial to what we're trying to do, is the workforce for healthcare in all of Europe. We are short of doctors and nurses in a very, very major way. For example, in Italy, we were told in our conference this afternoon that some 60% of doctors are over the age of 50, and some of them are retiring early. And the numbers of medical students coming through will not fit that number. Similarly, for many other European countries. So the report is multifactorial, going from prevention using lifestyle, using education, using medicine to correct metabolic abnormalities, and we still don't know if that will have beneficial effect, through to a workforce which is trained and competent and will be proficient in helping the aging population.